This is a case of 60 years male patient having swelling over this umbilical region, and this is a case of midline hernia. These are the two rectus muscle, and this is the linea alba. Probe is placed on epigastric region here transversely, and now we will go slowly step by step downward inferiorly, keeping this linea alba in transverse view. You see that this is the rectus muscle, this is linea alba. If you go inferiorly, now this is another rectus muscle. This is right side rectus muscle. Here this is linea alba, and if we go inferiorly, this linea alba is little bit hazy and not clearly seen between the two rectus muscle. And still, if we go downward, this is the rectus muscle ending over here in the medial margin, medial border, and there is no any linea alba in between. This is the second rectus muscle, and there is a gap in between, and you can see this here peristalsis, and the gap is very wide, maybe around 2 centimeter. Further inferiorly, if we go, still the rectus linea alba is not seen. Now inferiorly here we can see once again this linea alba, but what we see here above this linea alba is the small bowel loops, which are located superficial to the rectus muscle, which is not its usual location. And here, yes, you can see this gapping. This is the left rectus abdominis, and medial to this margin there is a gapping and herniation of the intestinal loop, small bowel. भाई पकड़ो यार, तुम क्या कर रही हो? ढीला ढीला मत करो. This is the rectus abdominis muscle. This is linea alba. Here it is little bit swollen. Thickness is increased as compared to here in the epigastric region. And these small bowel loops, they are superficial to this linea alba. Now this is the inferior part here. Here we will not, here in this part, as we go inferiorly, the linea alba will not be present. Here this recti muscle, they are fused, and no linea alba is seen. Further downward, both the rectus muscle, they fuses to the pubic symphysis. This is the midline part. Once again, you can see these two recti muscle, and there is a gap. So this is the way to evaluate. Now, if you take the longitudinal section, we can. This is the what we say linea alba. This, and if you take the longitudinal view and go on tracing inferiorly, here this is the linea alba, and it is further here not seen. Here is the site of herniation defect. These bowel loops are a little bit hypoechoic, it could be gangrenous, but we cannot evaluate in ESG.